Fifth semester head-to-toe exam. Introduce self to patient. Hello, my name is blank, and I will be your nurse today.
Hi, my name is Julia. I'm going to be your nurse today.
Hi, Julia.
Nice to meet you.
Nice to meet you as well.
Explain procedure. I will be doing a head-to-toe assessment, which is where I perform a general assessment of your skin, mobility, and functioning of major systems.
So I'm going to go ahead and do a head-to-toe, which means I'm going to go ahead and get an overall look of your skin, note if there's any mobility issues, as well as listen to your heart, your lungs, your stomach, see if there's any abnormalities or issues of pain.
Okay, sounds good.
Provide privacy. Close the door or curtain.
I did close the door when I walked in, but I also will go ahead and close the curtain just in case somebody happens to walk in.
Okay, great, thank you.
You're welcome.
Perform hand hygiene. Student performs hand hygiene with soap and water or hand sanitizer. Identify patient with 2 patient identifiers. Student identifies the patient with 2 identifiers, name and date of birth, and medical record, and physically checks the armband.
Okay, so I was going to go ahead and ask, if you don't mind, your name and date of birth, and make sure that it's the same on the armband.
Okay, my name is Sophia Reynolds, birth date of February 23rd, 1984.
Okay, thank you very much. Sophia, nice to officially meet you.
Thank you, nice to meet you as well.
Verify patient allergies. Check armband and med chart with patient allergies.
So do you have any allergies by chance?
I don't have any allergies at all.
Okay, I didn't see an allergy band, so I just wanted to double check.
Okay, thank you.
I also didn't see anything in the MAR.
Very good.
Current complaints, problems, symptoms. Student uses OLD carts, which stands for onset, location, duration, characteristics, aggravating, alleviating, radiation, timing, and sensitivity mnemonic.
So, are you having any issues today? Any complaints, pain, problems?
No, not at all. I'm just here for a physical for my new job.
Okay, great. So a normal checkup.
Yes.
Wonderful. So there is absolutely no pain whatsoever.
0.
Okay, so on a scale of 0 to 10, you've already said 0. Thank you very much.
Absolutely.
Current medication. Ask what medications the patient is taking, the med dose and frequency that is prescribed and not prescribed, and what they're being used for, including any herbals or over-the-counters.
So by chance, are you on any medications that are prescribed?
I am not taking any prescribed medications.
Okay. Are you taking any medications that aren't prescribed to yourself?
I take a multivitamin with iron. I take calcium on a daily basis, and Tylenol or Motrin every once in a while for any pain.
For any pain issues?
Yeah.
Okay, so the multivitamin is daily. Pain is resolves with Tylenol, it sounds like. And then do you have any other remedies or other herbal medications, let's say, that you use?
I don't.
Okay.
Mm-mm.
Smoking, alcohol, and drug use. Note if patient is smoking cigarettes with the number of pack years, how many alcoholic drinks per day, and any recreational drug use.
Do you happen to be a current smoker?
I am not.
Were you ever a smoker previously?
I was not.
Okay. Do you happen to use alcohol?
I have some occasional drinks on the weekends.
Okay, what kind of drinks?
Usually just some mixed drinks.
Mixed drinks?
Yes.
Okay. How many would you be having in one sitting?
Like 1 or 2.
1 or 2?
Yeah.
Okay. And how many days a week would you have 1 or 2 in a sitting?
Maybe twice a week at the most.
Okay, twice a week at the most. Thank you. Also, do you by chance use any other recreational drugs? Now, mind you, medical marijuana could also be a part of that.
No, I don't use recreational drugs at all.
Okay, thank you very much.
Sure.
Past medical history. Ask for any medical, past illnesses, chronic conditions, or hospitalizations, as well as family history.
So do you have anything on your chart as far as past medical history goes?
No, I've had 3 kids, but that's about it.
Okay, and all of the children seem to be healthy and were born at appropriate time frames?
Yep.
Okay, and any complications that arose with that at all?
None at all.
Okay. Do you also have any other issues in your family, for instance?
My dad has heart disease, but he's still living.
Okay, that's great.
Mhm.
It is. Okay,
Yes.
so when you say heart disease, do you mean that there are issues with the actual blood flow that's circulating through, or does he complain about palpitations?
So he had a heart attack
Oh, wow.
at a young age. He was 46. He had a heart attack, but he's taken good care of himself since then.
Fantastic.
Mhm.
So I'm glad that hear that he's doing well. Because he was so young, have you seen anybody else in regards to doing a workup, cardiac wise?
So I've not seen a cardiologist, but I do have annual tests for high cholesterol. I get annual physicals with my primary care physician, and we
Okay.
talk about it every year.
Wonderful.
Past surgical history.
Have you had any surgeries?
I've not had any.
Okay, now you did mention you had 3 babies. So
Mhm.
were those vaginal deliveries or those C-sections?
I did have 2 C-sections.
Okay, so were there any issues with the incisions or anything like that afterwards?
No, I
Okay.
recovered very well.
Wonderful. I'm glad to hear that.
Vital signs, blood pressure, temperature, respirations, and pulse. This will be done in a different video. General survey, assess for general appearance, alertness.
You appear to be alert because you're staring right at me, making very good eye contact. Your smile is beautiful. It's actually symmetrical bilaterally. I do see that you are attempting to sit up upright, trying to maintain good posture. Overall, you appear to be healthy. You don't appear to be malnourished, for instance.
Gait and coordination.
I will have you go ahead, however, and walk across the room so I can make sure that you're walking steady, not having any abnormalities while you're walking.
Okay.
Okay?
Cracky.
I did hear a little bit of cracks in the knees when you're getting up and walking around. You did appear, though, however, to be well coordinated. Your arms had moved appropriately as you were walking across the room, and you seemed to have a steady gait.
Hygiene, nutritional status, and speech.
Hygiene-wise, you appear to be clean. It looks like your nails are appropriately manicured, as well as your toes. I don't smell any malodorous smells coming from you at all. Your hair looks like it's very neatly done. Let's see here, and as far as, let's see here, so I said appearance, and what else am I?
Body position and posture.
Okay, and I had mentioned about you sitting upright, erect, not slouching too much.
Nutritional status.
You appear to be well nourished,
Speech.
and speech is clear.
Skin assessment. Integrate this throughout the exam. Color. Appropriate for ethnicity. Note if any redness or discoloration.
Okay, so as far as color goes, you do look, are you Caucasian?
I am
Do you
Caucasian.
have any Hispanic or Latina?
I do not.
No? Okay. So you then do appear to be appropriate for ethnicity. As far as your legs and your fingers, you do look a little red. Are you cold?
I'm a little chilly, but I'm
Do
okay.
you want a blanket?
That's okay. I'm totally fine.
You definitely see a little bit of redness.
Yeah.
So speaking of chilly, let me go ahead and just palpate here. You do feel warm, however.
You don't.
I know, I'm so sorry. I wish I should have warmed up my hands. But you do feel warm, at least with your upper extremities, and I'm doing the same thing with your lower extremities, all the way down to your toes. Texture-wise, your skin does feel smooth. I don't see any issues with lesions, roughness, scaliness, dry skin even, not even an issue with that.
Moisture and lesions.
Once again, no lesions noted. I'm sorry, I'm going to look behind your
That's
legs
okay.
as well, just to double check that there's nothing back there. Could I have you actually stand up while we're
Yeah,
at that, just so I can
absolutely.
see your front and your back side?
Mhm.
Thank you so much. Let's see here. Okay, no lesions are noted. Thank you. You were welcome to go ahead and sit down.
Edema.
And I'm going to go ahead and palpate for edema. Basically, all that means is they're extra fluid. So I'm going to go ahead and take my cold hands.
Okay.
Apologize. Palpate down. None noted. The right side. None noted on the left. So bilaterally upper extremities appear to be fine. I'm going to palpate the lowers. Making sure to get the back and the feet. Nothing over here. Oh, so sorry. I'm
That's
working my
okay.
way on up. Just double checking there. I do not see any edema noted.
Skin turgor.
Check your hand and your forearm actually by grasping a little bit of your skin to see how quick it goes back to position. Do you feel like you're a little dehydrated by chance? 'Cause it is a little
Possibly.
bit slow.
Possibly. I've been working some long hours here lately, so
That'll do
just
it.
slightly forget to drink water
Definitely
sometimes.
try to drink 2 to 3 liters a day.
Leave my old skin alone.
I wouldn't say it's old, but I could definitely tell that maybe you need to just drink some more water.
Yeah.
Hair distribution is even.
Hair distribution does appear to be even and appropriate as far as, let's see, at the top of your head, you have a nice full set of hair there. And then even your eyebrows look appropriate. There's nothing where it's missing and uneven.
Head and face neurological exam. Facial expression and symmetry. Patient states the name, current location, day of the week, and year to assess for level of consciousness and orientation.
Okay, so you were looking at me. You appear to be alert. You already had smiled. I'll have you go ahead and give me another big smile, though, however. Have a beautiful smile, as I mentioned before, and so bilaterally, it's appropriate from one side of your face to the next. I will go ahead then and have you actually puff out your cheeks for me. Very good. Can you give me a frown? Wonderful. And can you pick up your eyebrows? You already told me
Yes.
your name and date of birth, so thank you very much. Do you happen to know what the day of the week is?
It is Friday.
And do you happen to know where we're at right now?
We are at Lord's University.
Okay, so you happen to be alert and oriented to person, place, time, and why are you here at Lord's University?
To get a physical.
To get a physical, so situations. You're
Yes.
alert and oriented times 4.
Excellent.
External eye structures. No droop, edema, discharge, sclera are white. Full lashes are distributed on the upper and lower lids.
All right, so as I'm looking at your eyes, I do not see any discharge from your lacrimal ducts. I don't see any edema. There doesn't appear to be drooping. I will go ahead and have you close your eyes as tight as possible and open them. All right, so they did that appropriately. Your eyelashes also appear on the top to be even, and you have a fair amount of eyelashes on the bottom, but all evenly distributed.
Perla. Pupillary size in millimeters. Move pen light across each eye laterally to medially, watching for direct and consensual reaction.
So I'm going to go ahead and check to see how well your pupils will actually constrict and dilate, okay?
Okay.
So what I'll do is I'll have you look right here at my nose. I'm going to shine the pen light coming in from the outside in to see how well those pupils will constrict.
Okay.
Okay, so go ahead and take a look at my nose. All right, so they did constrict appropriately when the light was shined in them. And as far as the millimeters, they do look to be about between 2 and 3. So that tells me as far as constriction goes, but I do have to check to see pupils are equal, round, reactive to light, but as far as accommodation goes, I will have you go ahead, you'll look from a distance
Okay.
out that way, and then I'm going to bring my finger in and have you divert your eyes towards that, so I can go ahead and see if your pupils, which are now dilated, will constrict upon the moment my finger comes forward towards your face, okay?
Okay.
And now. And they did constrict, so you do have accommodation as well.
Okay.
Vision. Ask the patient to look straight ahead without moving their head and follow the movement of your finger through 6 cardinal positions of gaze.
Okay, so I'm going to have you go ahead and keep your head straight and sit up erect if you don't mind. I'm going to have you look at my finger, and I'm going to go ahead and want you to just follow my finger with your eyes, not your head.
Okay.
Okay, I'm just going to make sure that your eye movement is appropriate and to see if there's any issues going on. Okay.
Okay.
Do you wear contacts or
I
eyeglasses?
do have contacts in.
You have contacts in, and do they appear to be working well?
Yes.
Okay, we'll find out more later. But I just want to make sure you can see my finger. Okay, so you're watching my finger,
Mhm.
and here we go. There's a little nystagmus there, actually. The nystagmus there as well. All right, so slight nystagmus, but appropriate otherwise as far as following the movement of my finger.
Assess for hearing.
So we're going to go ahead and assess for your hearing. I'm going to whisper behind you
Okay.
a couple words, and I would like you to repeat them back to me.
Okay.
So I'm just going to walk around over here.
Sure.
Please repeat.
Lords University.
Very good. And it appears that you are hearing appropriately. I forgot to ask, however, you don't have any hearing devices that you
I do not.
have used or issues with your ears where you needed anything like that in nature? Wonderful.
No.
Inspect mouth and mucosa. Student inspects by having the patient stick out tongue and uses pen light to inspect.
So I'm going to go ahead and ask you to open your mouth, and when I do that, I'm going to shine the pen light in so I can kind of get a clearer picture of everything that's going on in your mouth.
Okay.
Okay, so I'm going to have you go ahead and open up your mouth. You have all your normal teeth. You don't have any issues going on, any cavities? No? Okay. I'm going to shine the pen light in so I can get a better look. It looks like your mucosa is pink and intact. It's not reddened necessarily. You appear to have all your teeth. Whenever you stick out your tongue and say, very good. Your tongue isn't coated at all, and it's an appropriate pink color. So thank you so much for doing that. I appreciate it.
Sure.
Neck abnormalities. Palpate neck for bilateral symmetry of muscles. Inspect and palpate the thyroid for midline and symmetry.
So I'm going to go ahead and actually feel around on your neck
Okay.
to see if there's any masses or abnormalities. Make sure that your thyroid or even your trachea, for instance, is midline.
Okay.
Okay?
Mhm.
I'm sorry once again about
That's
my
okay.
cold fingers. All right. I'll look over here. I don't feel any masses. There's no bulging. Your trachea appears to be midline, as well as where your thyroid would be located.
Range of motion, forward flexion, backward hyperextension, look over each shoulder, and ear toward each shoulder.
So I'm going to go ahead and see how well you can bend your neck forward and backward.
Okay.
I'm going to have you take your chin to your chest.
Okay.
Is that uncomfortable? Do you
No.
feel there's any tenderness?
Mm-mm.
No? Okay, go ahead and make your, yep, there we go, all the way hyperflex. No issues there as well? No? Wonderful.
No issues.
No issues? Okay,
No.
great. Okay, go ahead and look to your left over your
Okay.
shoulder, please. And now go ahead and look over to your right shoulder.
Okay.
Okay, and that felt okay? You have good
Everything's
range of
fine.
motion? Wonderful,
Mhm.
thank you.
Ear to shoulder.
I'm going to have you tilt now your head,
Okay.
ear to your left shoulder. Can you do it a little bit more?
No.
No? Okay, can you go to the right side? Do it a little bit more? There you go. You're cheating. All right, thank you. Did you have any issues though,
No,
however, when
not
you
at all.
did that?
Mm-mm.
A tenseness?
Mm-mm.
Okay, thank you.
Upper extremities, assess and palpate. Begin with the arms, check for strength. Patient extends arms toward examiner and asks patient to resist in an upward and downward motion.
So I'm going to go ahead and ask you to please place your arms straight out
Okay.
and extend them. I'm going to put my hands on top of yours
Okay.
and ask when I push down, you resist and try to push up.
Okay.
Okay, go ahead and feel free to do that now. Oh, you are strong. It's a very good 5+. Go ahead and now push down. Very strong. 5+, definitely. You work out. Thank you very much.
Elbows. With elbow flexed, examiner pushes against and pulls back on patient's forearm.
All right, so I'll have you go ahead and put your elbows like so. I'm going to go ahead and place my hands here. I want you to pull me towards you.
Okay.
Okay? Very strong. Now push against me. Very strong. Okay, so that is a good 5+ both ways.
Hands. Examiner crosses arms and requests patient to squeeze fingers with hands.
So I'm going to go ahead and cross my hands, but what I would like you to do is take your hands and grasp onto these fingers
Okay.
and squeeze them as hard as you possibly can. Very good. All right, you are welcome to let go. You are very strong. That is definitely 5+.
Grade pulses. Assess for capillary refill.
So I'm going to go ahead and check the pulses of your radial
Okay.
artery right over here.
Okay.
Sorry, once again, my
That's
hands
okay.
are cold. You got a good 2+ radial pulse over here on your left side. There's a good 2+ radial pulse on your right side. Very good. And I can actually see 1, 2, 3. So your cap refill we really would like it to be less than 2 seconds. It's taken a little bit longer than that. Are you really, really cold?
I am chilly, but it's okay.
I'm so sorry. Okay. So I would like to see that your cap refill would have been less than 2 seconds. It was a tad greater than that.
Posterior and lateral thorax. Position patient sitting upright. Stand behind the patient, inspecting the thorax for shape, symmetry, and ease of breathing.
All right, so I'm looking at your back actually, and it appears that there is symmetry. It doesn't appear that well, actually, is your one shoulder slightly
Yes, it
up
has
higher
been my whole life.
than the other? Have
I
you
can
ever?
raise the other one.
Than the other? Have you ever had any issues in the past, scoliosis, for
I have
instance,
not.
or anything?
No,
okay,
I was
but
whipped
it
up
is
several times.
slightly up on the left than the right. Okay, there's that. It does appear that you aren't having any issues breathing.
No.
No? Okay.
Check AP lateral diameter. Adult AP is 1/3 to 1/2 of lateral diameter. Note any deformities, position of spine, slope of ribs.
Pick up your right arm right there. I'm going to measure your thoracic cage on this side and compare it then. It's best, I'm going to have you stand up.
All right.
Because I'm not going to work out really well with that bed, okay?
Yep.
I'll go ahead and raise there we go. So I'm measuring your thoracic. Now you go ahead and turn if you don't mind. 1 to 2. All right, so you have a good 1 to 2 ratio. It doesn't appear that you have like a barrel chest, for instance. I will, if you don't mind, allow me to go ahead and lift up your shirt in the back. Okay, try not to expose you too much. About the 10th rib, I'm going to place my cold, frigid hands. And I'm going to have you go ahead and take a nice deep breath. All right, and now go ahead and exhale. All right, so what I'm really looking for is just making sure that your thoracic cage didn't enlarge too much upon inspiration and expiration. It's supposed to be, typically with my thumbs, not supposed to move any more than about 1.5 to 2 inches. And so it's quite appropriate. Please feel free to have a seat.
Thank you.
Thank you.
Anterior thorax, expect for shape of thorax and assess breathing, auscultate breath sounds.
So as I'm looking at you, once again, it appears like you're breathing well. It does appear that your left shoulder is slightly higher than your right shoulder. But other than that, I don't see any other issues with symmetry.
Assess breathing, auscultate breath sounds.
So I'm going to go ahead and listen to your breath sounds. And so every single time I place the diaphragm on my stethoscope on your chest, I'd like to give one good deep breath in and exhale.
Okay.
Okay? Let me know if you need to take a break though, too.
Okay.
Okay?
Thank you.
All right. Feel free. I'm going to move this a
Okay.
bit. Thank you. Okay, I'm going to check under here as well. You're doing great. Feel like you're breathing okay?
I'm doing great.
Okay, one big one. There we go. I'm going to compare the other side now. Good. Oh, sorry. I'm going to make sure I get it right there in mid-axillary. Very good. Okay, clear. Do you need a break?
I'm okay.
You're
thanks.
good? Okay.
Yes.
Everything sounded clear with your lungs.
Okay.
And it appeared that as you were breathing, you looked like you had a regular rate and rhythm.
Okay. Excellent. Thank you.
You're welcome.
Auscultate breath sounds from the posterior thorax.
Okay, I'm going to actually have you stand up if you don't
Okay.
mind.
Mhm.
And I'll,
way?
yes,
Okay.
thank you very much.
Mhm.
So once again, once the diaphragm of my stethoscope hits your skin, I'd like you to have a nice big deep breath in. Very good. I'm going to come up from underneath.
Okay.
Oh, try that again. I'm so sorry it was over your bra line. I apologize. I heard some crunchiness. Very good. And the other side. Very good. Thank you very much. I
Sure.
appreciate that. Even the lungs on the posterior side sounded actually clear.
Okay, great.
Determine rate and rhythm of breathing. For the purpose of the video, this will not be done right now. Heart. Student will auscultate heart sounds at aptum, auscultate with the stethoscope, flush to the skin, and at appropriate intercostal spaces. Report findings.
Okay, so if you don't mind, I'm going to listen to your heart
Okay.
sounds. There's 5 different places I'll be putting my stethoscope, the diaphragm only at this point, just to make sure that for a full beat, I can hear your heart going lub duh.
Okay.
Okay? Yeah, I was there. Just faint, I'm sorry. Really hear it well there. If you don't mind, I'm gonna come
Okay,
up from underneath
sure.
here. Your tricuspid. I apologize, my cold hands. Very good. And the mitral valve. Sorry, I have to pull up your
That's all right.
bra just a tad. Very strong. Okay, very good.
Student assesses apical
It's
rate
not-
and rhythm.
As far as your pulse goes, I was listening to the mitral valve right here, which is
Okay.
also known as the point of maximal intensity, otherwise known as your apical pulse, and I would listen to it for a full minute if it sounded irregular. However, because it actually did sound regular, I could listen to it for 30 seconds.
Okay.
Abdomen. Have the patient lie supine in the bed. Keep
Okay.
upper chest and legs draped only to expose the area just above the xiphoid process down to the symphysis pubis.
I'm going to go ahead and ask you to get into the bed.
Okay.
I'm going to go ahead and actually put some covers on you,
All right.
which you might enjoy that part of it. I'm going to go ahead and push the sidewall down for the moment so I can have easier access to you. Okay. I'm going to put it up a little bit so that way you're not bending down. Do you feel comfortable laying in
I
that
do.
position?
Thank you. Yes.
So, just slightly, ever so
Okay.
slightly, just bend your legs, not all the way up. Okay, I'm gonna go ahead and expose, pick up your shirt then to your xiphoid process, and then lower your shorts just down right to where your pubic symphysis is, okay? As far as looking at your abdomen, it actually looks flat, and there doesn't appear, from what I see, to be any abnormalities with your skin. Doesn't appear to be any bulges, distension, any masses. Of course, I'd have to check further by palpating, which I'll do later if you're okay with that. Are you having any tenderness by chance?
I am not.
No?
Mm-mm.
No issues with your belly?
No.
Okay.
Auscultate bowel sounds in all 4 quadrants. Listen in each quadrant once for a minimum of 5 to 20 seconds for repeated gurgling.
So I'm going to go ahead and actually take a listen with my stethoscope with the diaphragm to hear how well your bowel sounds are working, okay?
Okay.
All right, I'm going to start up here in the left upper quadrant, and I'm going to listen for a good 5 to 20 seconds, just to see if there's any gurgling or bubbling. There's some active gurgling and bubbling. So, as far as your bowel sounds, they are active, that is for sure. A little hyperactive in the lower, left lower quadrant, actually.
Palpation. Lightly palpate over each quadrant, laying the palm of the hand with fingers extended and approximated lightly on the abdomen.
So I already mentioned before, if you had any pain or tenderness, you had said no. However, during me palpating, touching upon your abdomen and pressing in roughly about a half an inch to an inch, let me know if there is any tenderness.
Okay.
Okay? So I'm going to go ahead and palpate the dipping motion all the way around. Very good. Abdomen looks great.
Lower extremities, assess and palpate.
I'm gonna go ahead and pull your shirt back down. You're welcome. You can go ahead and pick that up and cover yourself up a little bit better if you'd like. I'm gonna go ahead and look at your lower extremities, your legs, and note any issues with the skin. So as far as any lesions or anything goes, I don't see anything like that. Color actually looks appropriate. I'm going to check for temperature once again as we do it all the way through. You are a bit warmer now. I don't see as much redness except for a little bit in your tootsie toes. There is a little coolness in your toes actually. But your skin appears to be very smooth to the touch, not rough or scaly at all.
Hip, lift each leg up against the examiner to test for strength.
So I'm going to go ahead and ask for you to lift your leg up as I push down.
Okay.
Ooh, very strong. Good. 5+. Very strong as well. Did that feel okay? Was that hard?
No, totally
Okay.
fine.
Okay, great.
Ankles and feet, point toes down, then up.
All right, so I'm going to have you point your toes down. Push against me. Very good. Now go ahead and pull up. Very strong. Okay, good 5+.
Assess for pulses and assess for capillary refill.
All right, so I believe I did assess earlier for edema, but I'm just going to double check now that you're laying down like so. And as I'm doing that, I'm also going to check cap refill, which it is a bit sluggish in your tootsie toes, and I think it really is because you're cold. So it is greater than 2. And I am going to go ahead and palpate for your dorsalis pedis pulse, which it feels like it's a good 3+ actually in that right side. Dorsalis pedis on the left. So 2+. All right, and then I'm going to go ahead and palpate your posterior tibial on your right side, and that's a good 3+. And your posterior tibial on the left is also a 3+.
Closure, reposition the patient for comfort, give the patient the call light, leave patient in a safe environment.
Go ahead and cover you up. I so appreciate your time. Thank you so much for letting me check you out and make sure that you're healthy. Is there anything else that I can do for you to help you be more comfortable? Would you like me to put the head of your bed up more?
No, I'm fine like this.
You're
I'm
fine
gonna
like
take a
this?
nap.
Oh, good. Okay. So you get your rest. I'm going to go ahead and put the side rails up. I'm going to lower the bed so that way if you do decide to get out, you don't accidentally have a fall.
Okay.
And then I'm also going to make sure that you have your call light. Our call lights are a little different now with updates in technology. So let me go ahead and put this in your hand here.
All
And you
right.
just press that button if you need me.
Very good. Thank you so much.
Thank you so much for your time. And would you like me to close the door on my way out
That
or
would
leave
be
it open?
great.
I will do that. And I'll
Thank
go
you.
ahead and sanitize my hands. Have a great day.
You too.
Thank you.
Thank you.